So repeatedly I say, and I tell it to all of my candidates that, look, please, I mean, you don't have to take any failure on your heart. Okay, maybe it can be a stepping stone towards your success, isn't it? So yes, it feels bad. Nobody wants to fail any exam, and almost all of us, almost, and I can bet on this, almost all of us are the kind of very good students, okay, starting from your the graduation and then post graduation as well. So, I mean, on the other hand, this exam is so competitive, isn't it? I mean, we have to compete brains all around the globe. Okay. So this is what, I can, they think of that, of course, sometimes when we are competing with brains, so sometimes, I mean, things can happen. And these days, the exam is tough, result is tough. And, yesterday in group, Habiba was saying that Dr. Zaib doesn't agree with the what we want to say. See, I do agree, but at some points, I had been a student as well, isn't it? I have never been a teacher. Okay, I have been a student as well. I have failed this exam once, and that was so close as well. So that's why I can feel the pain. I can feel the agony. I can feel, the what I can say, the torment what you guys are going through. Okay, at the my exam back in 2018, the pass marks were 68 and I scored, I think, 66 or 67, or I scored 65. Okay, so it was kind of the 2% only. Okay, so it is terrible. And similar episode repeated in part 3 as well. Can you imagine traveling all the way to UK and then failing your exam by just only 2%? 62 was pass marks and I scored only 60%. Okay, so that's why, when I say I can feel your pain, so trust me, I can feel, because I have been there. And yesterday I've been talking to so many candidates, here and there, over text and over phone as well. So literally, I was feeling the pain. Okay, but on the other hand, it's not like that we just have to stop right away. Okay, we don't have to stop. We just need to stop when we think we are done. And when you are going to done, from this chapter MRCOG, when of course you are going to become MRCOG like me, like so many other candidates. So I just want to ask you guys that, if I have failed one exam, okay, or twice maybe, so, do you think I was not a good candidate? Or do you think that, I was not capable enough to even teach anybody, or even, the do anything? And, the Alhamdulillah, I had been so lucky that I have been examiner as well for part 3. So do you really think that, failing one exam, I mean, has given any kind of less opportunity to me? Yes or no? I'm 100% sure no. Okay. On the other hand, yes, it is bad. No, not at all, right? See, see, that's what I, want to tell you. It's not like that, I'm like, I mean, promoting my failure. No, I'm just telling you that, this is a very normal life to every candidate there is. Okay. I know, many of us have never failed any exam. Okay, and that's doable. I had also been a, the position holder throughout. But, this MRCOG really gave me tough time. And I was telling it to Rabia yesterday that, you guys have been amazing. Okay, this batch particularly, we have had very good bonding, and we have been, discussing, studying together and everything. So yeah, see, so I know what Madiha has the potential. I know what Habiba knows. Okay, I know, the Rabia and, the so and so Sana. Yes, okay, trust me, so please don't take, the everything on your heart. And and so that's why I have chosen this quote. This quote is my favorite one. So you don't have to stop when you are tired. Stop when you are done. Okay, so after this MRCOG, I have done 2 more post graduations as well. Okay, so it's not like that, I was kind of the incapable of failing one exam. Okay, it doesn't mean that I was incapable of not doing anything. All right. So today I am having 4 boards. So do you really think that, I have had any, I mean, a very smooth journey? No. My FCPS was first attempt, okay, by all means. But this MRCOG really gave me tough time. And then MRCPI was okay. And then European board was okay as well. Okay. So please don't feel bad. Okay. And don't take it on your nerves. Okay, I mean, 1 day, 2 day, 3 days, that's more than enough. But afterwards, what you need to do is you have to work hard. you need to work smart, and you have to stay focused. Okay, trust me, three things, if you will apply on your any of the exam, your life will be so easy, so easy. You all the time you need to be motivated, all the time you need to be the focused, and of course, the and your studies should be targeted studies. Okay, it should be like that, okay, so and so in studying that much, so I have to study that much too. All right. So I mean, we can't compete with all of the candidates all around the globe, isn't it? So what you need to do is you just need to look at yourself, your circumstances, your own, the kind of troubles, hurdles, or you name it, and you can count it, isn't it? So please don't try to fit in anyone's shoes there is. I don't know you, you don't know me. Okay, I have had a very bad day today. Trust me, trust me, but still I'm having all my energies and I'm trying to smile, I'm trying to laugh as well. I have really had a very tough and a very bad day as well. Okay, but still, we have to move on. So I can't say no to my work. I have to work because I had promised yesterday that I'm going to be talking to all of you, and of course, I'm here. All right. So you can't, fit in my shoes. I can't fit in your shoes, but still I can lend my hand to you, and I can lend, my everything to all of you as well. Okay. My expertise, my guidance, my, the techniques, my tactics, anything, anything. Okay. Leave the job. No, sweetheart, that's not, um, now in next the attempt, yes, of course I will definitely help you out, Sarah, so you don't have to worry about that. Okay, so I can see that Madiha wanted to share something with us. Okay, so all of you guys can the open your mic, can the share with me, and Dr. Hassan will join us soon as well. Okay, so you guys can talk to us, you guys can tell us what exactly you have faced in this exam, and what can we do little bit extra to pass this exam. Okay, no, you don't have to sit and study. That's I'm sorry to say that's not a good technique. Okay, because the by nature I must say that we all are working, and because we are working as an OBG, of course we have to work, in ward, and we have to work in theater as well. And if we are not going to do that, of course we are going to feel ourselves the less capable again, and yet again it is going to pose a lot of mental stress again. So I would suggest whoever is working, okay, work as it is. Even if you have flunked this exam by just the 1 or 2%, okay, 3%, or say what I have been scanning since yesterday. Okay, mind it, let me tell you, I could not sleep last night because I was so upset. I have been scanning, I've been talking to so many candidates all around the globe because of the time, the difference as well. But still, this is my job. I have to the give you my hand, my support as well in your tough time. This is a job of a teacher, isn't it? Okay, so what I have scanned so far is that candidates have failed. Candidates have failed with the margins. Okay, and it is from 59% to 65%, because 66 is pass 66 is pass marks, isn't it? Yes, exam is very tough, Marwa. Okay, exam is very tough. Okay. um yes. Aisha, sweetheart, let me tell you another fact. And to all of you as well. Okay, we are investing our time, we are investing our the a lot of energy into our studies and all. At the same time, what we are doing is, okay, what we are doing is that sometimes we are using our energy at wrong place. Okay, somehow. So again, the any course, doesn't matter my course or any ABCD course as well. Okay, no course is a guarantee for success. Okay, what exactly matters is the exam day, your own the mental status on that day, how you perceive the question. Okay, how you solve the question. All right. Yes, sweetheart, Habiba, that's what I'm telling you. Okay, it's not about the course. Okay. um well, if you guys remember me, the asking all of you again and again that please do EMQs. Okay, but somehow the everybody was so indulged here and there. Okay, So maybe, that was kind of, the thing that, the EMQ practice was little bit, the bad. Okay. So what I believe is EMQ has always been tough. Trust me. When I, the failed my exam, I have also failed in Ops EMQ. Sana, similarly like you. Okay. Ops EMQs were not up to the mark. Okay. And of course, I failed that exam. So later I realized that yes, there were flaws in my preparation. Okay. There were flaws in my, the tactic and, the techniques. And in very next attempt, Alhamdulillah, I passed my exam with good score. Okay. So, I mean, 54%, what I believe is that, starting from 50, okay, that is okay. Starting from 50. Okay. Okay. On the other hand, again, don't feel bad that, if you have scored, the low, maybe your technique needs little bit improvement. Maybe you need to solve a couple of more and more and more question. Okay. I will come to that question as well. Time management. Yes, time management, Shamika, is very important. Okay. Time management is also very important. Remember, I have been, the advising you all the time that please do Justin Kune book. Okay. And, Tahir Mahmood book, because these both books, maybe keys may be wrong because of the changing in the guidelines and TOG articles, but questions are excellent. Questions are so beautifully formulated that okay, we can do all those questions, because those are going to give us, the time, okay, that how we have to do. Justin Kune, okay, Justin Kune book, I literally, they like that book. Okay, apart from
Ma'am,
few keys. Okay, so yes, you have to do. Yes, please.
hello ma'am, assalamu alaikum,
Walaikum
and
salam.
hello to everyone. Actually, being the part of this journey with my mentors, especially if I say they are really, really very good.
Mhm,
On my behalf, if I share my experience, I see I am deficient. Actually, the questions are very tricky,
mhm,
lengthy, and they need a very thorough study uh,
mhm,
in preparation.
mhm,
If we say that no, we are right and questions are wrong, this is not good.
mhm,
Actually, simple labor module is very much tough, and
mhm,
it has so much options that you couldn't select the right choice. It is
mhm,
difficult for me. I'm sharing my experience. I didn't know the other students how they feel it and how they do it, but
mhm,
I think these are difficult. We need myself. I need more and more practice of these questions.
mhm,
And inshallah, I want to be part of your team in next session also. But
mhm,
I suggest that your lectures on labor modules are very short.
mhm,
Actually, I taken all your lectures 3 to 4 times. Actually, I
mhm.
think these are the keys for me.
Okay.
I have no time to study the proper guidelines and other articles. I am only focused on these lectures, which
Mhm,
you and Dr. Hassan delivered to us.
mhm,
I think that you taught us very much, but labor module is slightly short. Maybe you
Actually, we
think
have
that,
to cover
maybe you
guidelines,
think,
isn't it?
yes, ma'am, no,
Isn't it?
no, ma'am, yeah,
Hmm.
maybe you think that we are well known these modules, but we need it, we need it.
Mhm,
Uh, each and every question, especially in paper two,
mhm,
time is, ma'am, time is not a, their time is not a problem. I
mhm,
think there is a lot of time. We can do each and every question very easily. We can read them easily, but actually solving them is a problem.
mhm,
Time is not problem, but
mhm.
I think in next session, we will. I want that you will especially concentrate on labor module. There are a lot of
Okay, okay.
questions
I
from
will
labor
do.
module.
I will do. I
Yes.
will do that. I will do that. Okay, okay. And
Ma'am, I would
yes,
like
yes.
to,
Mm-hmm.
ma'am, assalamu alaikum.
Walaikum salam. Yes.
I would like to share my experience, ma'am. I failed at 64, and
Mm-hmm.
like I changed some of my answers,
Ooh,
and
that is bad. That is a
yes,
bad technique. Yes.
that's really a bad technique. Though I knew that the first answer that comes to your mind is, but I also found some labor questions very difficult. Those I changed. I marked initially those right. And for labor, like one of the friend was telling, practicing strategy questions would help, because like there was a cardiac patient, and in many of the questions the station given was +1 and like we all were confused between shall we deliver in the room or we deliver in the instrument, because when we solve strategy questions at +1, if it's OA and there is no problem, we can deliver in the room.
Yes.
But if at +1 and if it's OP, then only we have to take it to the theater. So many of my friends who who also failed at 64, 63, they did these labor questions wrong. And what I believe is that maybe the labor questions are so important that maybe they carry more score, isn't it?
No, it's not like that. Okay, it's not like that. Okay.
Okay.
As a whole, okay. So we will conclude, what are the points. So time management from one candidate, okay, labor and delivery questions from one candidate, and what else was EMQ practice, right? EMQ practice.
Yes, ma'am.
Now
And
coming
ma'am,
to
I would like to add, like my dear friend, she said that she was only like she because of her busy schedule, she was listening to the lectures. What I believe is definitely we should listen to the lecture. That's very helpful. But either you should read the guideline before listening to the lecture, or you should read the guideline after listening. If we read it before and one read after, then the retention of the lecture and the concept is very good, and it helps us solving the questions, isn't it?
Yes, exactly.
Yes.
Okay, now let me address another thing, because we do have very limited sources. Okay, so if I talk about the sources from where we have to practice, so we have books, and then we have the strategy e-learning, and I always recommend that. If you remember me, the advising you in the last days. So this is what I have done in my second attempt as well. In the last 10 days, I did only questions, and yes, strategy as well. Okay, so I mean, yes, question practice is must. So question practice, and on the other hand, let me address another issue. Many of you are so tempted with the past exam questions recalls. Okay, please don't get tempted. Okay, do you really think that after coming from exam, Habiba could have written 100 questions, or Rabia could have written 200 questions, or Madiha, or anybody? Yes or no? No, right? Nobody can be in exact or perfect state of mind to recall all these questions. Okay. I always suggest that, okay, just go through, scan that what topics are important. And then see, labor delivery, syllabus is not going to change at all. Syllabus is not going to change at all. What you need to do is you just need to pick what are the important topics, what are the recurring topics, and what you have to study. Labor and delivery is a very important part in the any curriculum there is. Okay, you name any exam and you will definitely see labor and delivery module, isn't it? So this is what you need to do is that now you need to study smart again. Okay, first of all, pick your what you can say shortcomings. If you think that your labor delivery module was not that good, okay, start your study from that labor and delivery module. For me as a student, let me give you my example, because I can just quote my own example, because I don't know you personally. All right, so I know you as a candidate only. So what I did was, I have never done biostatistics in my life till date. With all my exams, I have never put any extra stress on biostatistics at all. Okay, I have never done any, when I was a student like you guys in part 2, I was so weak in oncology. So because I knew that it is my weakness, so I didn't put my, the stress on these two modules. Rather, I put extra effort on labor delivery, because I am a working obstetrician as well. Plus, of course, I love maternal medicine module, and you guys know me. Okay, so what I did was, I put my all efforts into maternal medicine module. I put all of my all efforts into labor and delivery module, early pregnancy care. So I will not miss a single question, and alhamdulillah, I did. I literally hate, Toshin, you won't believe, till date I hate. Okay, oncology I never did. Oncology, this credit goes to MedExam as well. That when I started teaching for MRCOG Part 2, they asked me to take, the oncology, and later Dr. Hassan, always took oncology session. Okay, for me, I always hated oncology. I still date. I always, hate this biostatistics as well. Okay, so I would suggest all of you is please sit with yourself. Okay, give yourself time. After this, the time is over. Okay, 1 to 2 days after this, I understand that, this is so devastating. Again, I will repeat the same. Nobody wants to fail. All right, nobody wants to fail. No, I mean, nobody. All right, so what you need to do is you have to sit with yourself, you have to analyze yourself. Okay, yesterday I've been talking to one friend, okay, a very good student as well. So she told me that, she did one mistake, and now you guys are going to realize that as well. How many of you have flagged questions and later by the end of your paper you have unflagged the question? How many of you have flagged the question? You did unflagged? You unflagged all? Hafsa, Sana, you flagged, and you unflagged them all as well. Okay, this was a biggest mistake as well by some candidates. Okay, I came to know by 2 candidates, okay, that they forgot to unflagged. So remember, if the questions are unflagged, okay, so they won't be counted from by the computer. Okay, so they are going to be unanswered even if you have, the answered correctly. Yes, please do unflag those questions as well. All right, so this has been a mistake as well. So I literally, noted down in my points that what I have to address. Okay, if you have flagged your question in any of online exam, so please remember to unflag them as well. See, Sarah, this is mistake, sweetheart. Okay, trust me. Shamaka, yes. See, let me tell you, apart from the difficulty level of exam, there are tiny mistakes by us as well. Okay, like for me as a exam candidate, I did the couple of mistakes as well. All right, so I came to know yesterday from 2 candidates, okay, that they did the same mistake. They didn't do the unflagging is must, because this exam is computer based, right? So computer will pick your questions. If you have answered 100 questions, computer will pick 100 questions, and then the answers are going to be in one go. You got my point? So if you have not the unflagged your question, and say for example if 25 are flagged and you forgot to unflag them, so can you imagine that your result is just 75 out of 75 question?
Ma'am, how to unflag? I really don't know, because if I left some questions that okay, I'll answer them later, so they were just coming as incomplete question. So
Yes,
after
incomplete
finishing my
questions
paper,
mean
yes,
if whatever is given in red, okay, red
yes,
is going to be your the unanswered question or flagged question. And even if there is,
okay,
I don't know the color scheme, but usually green is answered, red is unanswered, and amber color is the flagged one. Okay, so you have to unflag. If you have answered your amber color, it has to turn green. This is what I know, because I have been into so many online exams as well. Okay,
like all the questions should be green at the end,
green.
you are saying, ma'am?
Exactly. This is what I want to tell you guys is, because exam is going to be, the questions are going to be counted by computer, not by any human. That who are going to give you margin. Got my point?
Okay.
So this is also a mistake. If by any chance anybody has done this mistake as well, so perhaps this could have been one of the reason of scoring low. Okay, I'm not
Ma'am, I
saying
don't
that
know.
all of you have done or no. Yes.
Actually, some of the questions like I left, they were coming as red. So in the end, I just finished those red questions. That's it.
If those were red, so you have to unflag them as well, because if you have answered, it will naturally turn into green.
Okay, any question that we are going to answer, whether the answer is right or wrong, that question will automatically turn into green, right? This is what
No,
you're
no,
saying,
no,
ma'am?
no. You have to unflag as well, because on the this is what, because in MRCOG, It was not, the online in my time. Okay. But I have done Irish exam. I have done European board and a couple of other tests as well. Those were online. So on top column, there was, the flagging. Okay. So I used to see, the screen that, okay, these green answered, these are unanswered, and these are flagged. So I have to remove those flag as well. I was
Okay,
telling it
ma'am.
to yesterday, the one candidate that, okay, in European exam, the same thing happened with me. And somehow in the last 3 minutes, can you imagine, in last 3 minutes, I did unflagging and then my counting was complete.
Okay,
Okay.
ma'am.
Yeah, I mean, this is what I know. Okay. Perhaps because I have been analyzing, I was up whole night last night. Okay. I was thinking, I was just trying to think that what could have gone wrong for, the such kind of result as well. Okay. Apart from difficulty level, there must have been something, okay, which have been done unintentionally or intentionally by any candidate as well. This could be one of the reasons. This is my conclusion. Again, let me tell you, this is my conclusion. Okay. Because I'm not RCOG, of course. I'm not examiner of part 2. Yes, part 3, you may see me, but not in part 2. Okay. So this can be one of the reason as well. Again, coming back to this part as well, that how you can improve yourself and how you can, how you can start. Clinical governance and ethical scenario source. No, nobody is working in UK. All we are dependent on, the sources available. And what are the sources available? No source. Okay. We just have exam questions book and we just have our, the knowledge. Okay. So maybe, the ethical scenarios or all these scenarios can be a little bit tricky in terms of that, because we don't pay heed to all these stations. Okay. No. It is helpful, Hafsa. Please don't mind me saying that because I did, this clinical governance and ethics from strategy only. Okay. I prepared my lecture from, the strategy only as well. Okay. So it's not like that it's not helpful. Okay. So again, let me tell you how you can, improve on yourself. All right. Sit with yourself. Analyze. What are your strong points? Make 2 columns. Okay. Write down your strong points and your weak points. Now tell me, if you are going for anything, what you are going to work on most? Weak points or strong points? First of all, no, this is wrong. First of all, keep your strong points strong at all times. Okay. Keep your strong points strong at all times. So, for example, you will be done with your strong points early, and then you can work hard on your weak points. If you will give so much time to weak points, what you will do is you will end up investing so many months or say so many weeks, and then you will be left with, the less time to even, the work on your strong points. If someone has no strong, no, everybody has, Toshin. So sweet, so sweet. But it cannot happen, trust me. everybody, everybody has strong points. Like me, I'm openly admitting. I know so many people are listening to me. Everybody, who knows me, they know me. I never did biostatistics, so what? I never do oncology, so what? Okay, my strong points are, and my candidates know me as well. Okay, Madiha, what is my strong point? Maternal medicine module, right? So
Yes,
alhamdulillah,
yes, yes, ma'am.
Alhamdulillah, till date, whatever I study, I hardly do mistake in maternal medicine module. Okay, trust me. Then comes labor and delivery, then comes early pregnancy, then comes, the infertility, sexual and reproductive health and everything. Okay. MRCOG exam makes you strong points in terms of yeah. No, Toshin. Now let me tell you, again, the way you look at the question, how you solve the question, that is important, sweetheart. Okay. So it's not like that it's all wrong all the time. No theory. Hafsa, no theory. Theory is not, I'm sorry if somebody is listening, theory is not that updated. Don't go beyond guideline. If you remember my first session, introductory session, I always say, first, they finish your bulk. And what is our bulk? Green top guideline, nice guidelines. Then
Okay.
comes, 60 to 70%, or you are done with your exam. Madiha, what do you think is important? Guidelines, right?
Yes, ma'am.
guidelines, right?
Tables and
So
charts.
here, this is what I have been emphasizing all the
Yes,
time.
yes,
Tables,
yes.
charts,
Charts,
algorithms. And I always
algorithms.
say
Yes,
that, okay, when you start your study, do try to make a separate folder. Okay, do try to,
yes,
I mean, please get a printer yourself, for God's sake.
yes.
Okay, please do print your own pages. Make you, one day I will show you guys my folders as well. Okay, I still use my folders, I still use my notes, and it's been like 5 years now. I'm done with part 2.
Okay,
Okay,
okay.
but still I'm using, my own folders. Exactly. Toshin, this is what you have to do. Okay, you have to make your separate folder for all algorithms, tables. Okay, whenever
I
you are
have also
studying.
registers, madam.
Yes, yes, I know. Because this is the best approach. Trust me, this is the best approach. Okay. So what you can do is, by the end, when you are done, okay, so please keep your strong points all the time strong, and then work hard on your weak points. If you will start working on your weak points, for example, I know many of you guys would love to start from biostatistics again, because I know many candidates, who were
No.
till one day before exam, they were just after biostatistics all the time. And oncology, they took a lot of time. And I have been begging, I have been telling everybody, please don't waste your time, in all these modules. Okay, how many questions will come? Like, Hafsa, I think Sarah has just told that one question was from Onco, and 4 or 5 questions were from, yeah, Toshin, isn't it? And 4 or 5 questions were from biostatistics. So do you really think that these 6 questions can, make your exam, the difficult? Apart from that, if you do your maternal medicine 100%, you do your labor delivery module correctly, if you do early pregnancy, if you do subfertility, sexual reproductive health, and urogynecology, very straightforward module. If you do all these modules perfectly, trust me, you can score, the much more better than, please do try to, analyze your result as well. Okay, I'm not saying that, you guys are not good students. I always say you all are absolutely, the marvelous. You guys do study so hard, but, do try to um no, we don't have to, we don't have to. And in fact, nobody knows what exactly is RCOG keys. Okay, all we can do is that we can just study, and we can be sure on our part that, okay, because I have done this from so and so guideline or so and so talk article, so yes, I'm confident that, okay, I have marked correct. Okay, so, and the exam is not out of syllabus and out of the box. Let me tell you this, a very, the harsh fact as well. It's not like, somebody from, the out of MRCOG is making paper. No, they are setting paper according to the syllabus. If you open your syllabus on RCOG, the website, you will be so surprised. Trust me, you will be so surprised that even, the as an overseas candidate, we are not, the studying that much, whatever is written in curriculum. Okay, so if you guys just, the after finishing this session, if you guys will open your MRCOG website, if you will see curriculum, trust me, you will see that, we as a, the mentors or teachers, we are teaching, accurately. We are telling you guys that okay, you have to focus on all these things. Okay, now from today onwards, the after you are, the over from this, the everything. Okay, no,
Over.
no, overall percentage. Okay, it's overall percentage. It's not like that you have to pass, the separately module separately. Okay, so it's a overall percentage. And mind it, by the end of your all MRCOG exam, only word pass and fail will matter. Don't compare that somebody has scored 80, 88, 82, 86. Doesn't matter. Even if you have scored 66%, Alhamdulillah. Okay, because all, nobody is going to ask you by the end of your MRCOG journey that, okay, have you been topper in MRCOG, or have you been gold medalist, or did you pass your all exams in first go? No, it's not, and it doesn't work like that. Okay, so, so this is going to be from my side, that what you need to do is you have to sit with yourself, you have to analyze your result as well. Please, try to, look at that, what were the good points and what were the bad points in which you have to emphasize more. Okay. So there is, and on the other hand, being a student, there is always more room for improvement, and there is always a room for improvement as well. Okay. And of course, being a teacher, I'm always there. I'm easily approachable. You guys can talk to me anytime. Okay. Do text me on WhatsApp, Facebook, Telegram, anywhere. I do respond. Okay. I do respond. And it's not like that, we are not going to, the help you, or me myself is not going to guide you apart from this course or out of the course, doesn't matter. Okay. So, please do talk to me. Do tell me what exactly are you feeling. Okay. Do tell me that, what exactly you need to, put your efforts on. And of course, because I am a teacher and I have to do some of the amendments in the course, so yes, I will take this as a positive feedback that yes, we have to work hard on labor and delivery module. Okay. On the other hand, labor and delivery, we just have the sources from NICE guideline and all, and labor and delivery module per se needs a lot of question practice. And from where we
Yes,
can
ma'am.
get those questions? Of course, we have books, we have the e-learning strategy. You can solve your questions online. Plus, you can discuss. Okay, you can discuss as well. Plus, they do try not to pick the recall questions first. Okay, and just they try to mug up them. No, mugging up of recalls is not going to help you. Again, let me tell you, yes, you can scan them, you can just have a look at them, you can just see that what are the recurring topics, what RCOG wants to they talk about, and what exactly they want us as a candidate to know. How to get strategy, Lipi? I will guide you. Okay, don't worry, I will guide you. I will guide you through, don't worry.
Excuse me, ma'am. Can I ask
Yeah.
one question?
Yes, please.
Yeah, actually, ma'am, I'm a fresh. I just passed MRCOG Part 1 with
Mm-hmm.
this grade med exam expert team.
Mm-hmm.
So I just want to have your advice that what would be the beneficial for me, that I'm planning to appear in the July 2024. So
Mm-hmm.
first I should read myself all guidelines, or I should join the course now, or in the month of January, after this
Okay.
January. Yeah,
Very
kindly
good
please.
question. Very good question, in fact. Okay, I appreciate. So, Nazia, if you don't mind, I would like to know what are your duty timings, how much time you can spare, and if you are on job, so what is the nature of job? Is it full time? Is it, the with
Yeah,
on calls?
yeah, ma'am,
Is
it
it
is
with
very, very, yeah, very hectic and full time.
hectic? Okay, very hectic and full time. Okay, so one thing. So, roughly, how many hours you can spare in a day?
Ma'am, hardly 2 hours.
Hardly 2 hours. Okay, and if I say close to exam, how many hours?
Ma'am, close to exam, I'm planning to take a leave for 1 month,
Mm,
as I
yes,
took leave in the part 1.
that one as well. Okay. Okay, I will suggest, just try to get a hold on, the syllabus first. Okay, just try to look at, and then, keeping in view of your, the job and everything, and of course, house chores, and, if you are, the having kids. So, of course, we have to look after our kids as well. So, apart from that, if you think roughly, because part two is very demanding, and yes, you have to give time. Sometimes you can't finish your one guideline in a day. So, yes, you have to finish it in very next day. If you will keep on the working on only one guideline, so you will be lagging behind from the schedule as well. Okay, what you can do is if, for example, if today was the VTE guideline, and somehow it is very tricky, if you can't finish it today, and you can do very next morning. Okay, second day, day 1, day 2, you can finish it. But if still you are the on VTE guideline, leave that VTE guideline now, move to next topic. Don't get
That,
stuck on
that,
one thing.
that's why, ma'am, I'm asking, it's
Hmm.
better that I do first guideline myself in a tension-free environment, and then I join the course after 6 months.
Well, tension-free environment, then you will be on one guideline for life. It is going to be so
Yeah, ma'am,
tension-free.
you are right. You are right.
So what I will suggest is that if you will be part of course, so this way or that way, because I keep sending one reminder, Dr. Hassan sends, the reminder, Dr. Rupam is there. You will see your fellow colleagues as well studying on daily basis. So this way or that way, you will study something. Okay, so if you can be part of course, so well and well good. If not, then do try to follow our the MRCOG part 2 guide group as well. We are running a schedule over there too, but the sadly, unfortunately, candidates don't participate there, although I lead the MRCOG part 2 guide the Facebook group as well myself. So but you can do that. Okay, you can do that.
Madam,
And you can be part of course as well.
Actually, I attended your last session in which you suggested that better you should go through the guideline by yourself.
I'm sorry, you took me wrong. You took me wrong. Okay, so candidates' questions were that the summaries. What if we only study summary? So my answer has always been that it's a good idea that you study guideline yourself. And then still, if you feel that you can't study the anything, then it's better. Then you can go through summary yourself. Okay. So this was the answer.
Madam, you are suggesting me to join the group now so that I will be,
because you can only spare 2 hours. So even if you don't go for January exam, by the time you will go for July exam, you will be prepared. Keeping in view of your 2 hours. Keeping in view of your 2 hours. Okay. So this is going to be my sincere suggestion. So on the other hand, the candidates who really want to start, again, so please do start as early as possible. Don't waste a lot of time. Okay. MRCPI, let me tell you, MRCPI is not that easier these days, keeping in view that, GMC is granted with this MRCPI again. So they are making their guidelines, the own guidelines. They have started, making their own guidelines from 2023. Okay. And there are so many guidelines again, and rest of the guidelines should be done from Green Top guideline and the TOG articles as well. Mind it. MRCPI pass percentage goes as high as 70%. Okay. So don't think that, it's an easy exam. Take it as an exam, another exam maybe. It can be easy in terms of that we don't face any EMQs. We don't have any numbers over there. Okay. So no numbers, no EMQs. So that makes it an easy exam. Okay. Only 100 SPAs and boom, it's over. Okay. But mind it, the in 2021, 70%. In 2020, one exam, okay, the percentage was, I think, 72%. And then 68, 69. So it is somewhere between 65 to 70%. Okay. Marwa, if you have done this July exam, I would suggest don't take a year break till next July. Okay. Yes. Okay. Go for January exam. Give your 100%. And inshallah, if it is for you, definitely, you will pass. Okay. Lots of candidates scoring 80s and 90s. It is in part 1. In part 1, you can score. Okay. And in MRCPI, no. When did you see that? 90s and 80s? No. 80s, yes. Okay. But not in 90s. Up to my knowledge, because I'm a teacher for MRCPI as well. So it's not like that. Okay. No. For MRCPI, no. 90% is the no. Books other than guideline for theory, no book. Okay. But yes, question books are there and you guys are familiar with that. Keep your 5-6 question books, on top, like Tahir Mahmood. Okay. Justin Kunje. Okay. Justin Kune book. Then Andrew Sizer. Okay. Get through. And what else? 5th book is going to be for EMQs. P. Sinha. Okay. P. Sinha, both parts. Even though, the keys are, the from the old. Okay. But you have to do questions. Okay. And questions are quality questions. I can see Sir Hassan is here. Hello. Good evening, Sir Hassan.
Good evening, Dr. Zaib. Good evening, everyone.
Hi, you were so quiet. I didn't notice you coming.
I'm just listening.
Okay, thank you so much.
I'm just keeping silent and listening because I joined later because I have some work to be finished. So I'm sorry for being late. and I was enjoying your information, your knowledge. So thank you for this wonderful advices to all of them.
Yes, sir. Any other thing which you want to...
Actually, I will talk about different point of view rather than from where you can study or how can you arrange your time. I would like to talk about the reformatting of the brain, okay? Because this is a major mistake I felt in the last 2 years. Many candidates are suffering from this point particularly. They are trying to study hard, revising everything, trying to catch everything. And then when they are facing the questions in the exam, they are not able to apply their knowledge. Okay, they don't know how they can utilize the knowledge, and this is the most important thing. One of my friends many years ago, when I was attempting the exam, one of my friends, we were studying together, and then I studied a lot. I covered everything, and he was very busy in UK. He was a trainee there. He was very busy. He has 1 week leave before the exam. So he just covered 25-30% of the curriculum. Okay. We went to the exam. He passed. I failed. I don't know why. Because my knowledge definitely is triple his knowledge. But he passed from the first trial. I failed. Now, from this point, I started to realize that this exam is not related to how much knowledge you have. This exam is how you can apply the knowledge correctly, think properly in the question, looking for the keywords, trying to analyze and interpret the knowledge correctly. According to the Royal College point of view, and what are the job descriptions of MRCOG trainee, the medical trainee, not from the perspective of a consultant, not from a perspective of a senior registrar. It's about the trainee job. If you are able to do this, you will pass even with minimal effort. And if you miss this, you will never pass. I'm really sorry to say that. You will never pass unless you are so much lucky guy. And I'm not a lucky guy, by the way. I'm talking about myself. So I used to find another way to pass this exam. So I try to, I'm always saying this, revision the whole curriculum. Re and vision. It means another vision, another understanding to the curriculum. How can I read the question? How can I interpret? And for this particularly, it took a lot of time and effort to reach this point. You know, I'm always saying this, Zaib. Now, candidates attending July exam, for example, if they attend the exam and I attend the exam, most probably they will not pass and I will pass. Why? Despite they are very strong in knowledge, they are prepared for the exam, and I quit the exam for many years. But I will pass by experience. I will read the question. I will take a vision, what is beyond the question? Where are the leading words? The problem is, number one, most of candidates are very stressed during the real exam. They are so much annoyed by the time. So they lose 50% of their concentration. Number two, they are fully dependent on the recalls and how can they are trying to, you know, involuntarily, in subconscious, they are reading the question, trying to find this question in their minds. I saw this before. He is not reading the question in simple, professional way. they are biased, so they miss a lot of points. Number three, they are trying to cover everything, and this is impossible. You have to understand, and you have to find some psychological capacity in your mind and your soul that some questions will never be answered correctly. Okay, so you are trying to answer it, read it once, twice, three times, wasting time, wasting effort, and then you will be hesitated, not confident enough to continue the rest of the questions. I will ask most of people who I think many people in this room attended the exam part 2 at least once. Okay, if I asked all of you, did you notice in the exam that you find group of questions very easy, and then you will find the group of questions very difficult? 3 or 5 or 6 questions consecutively, they are very difficult. Did you notice that? Yes, because the sequence of questions in the exam is planned and established by a psychologist who knows very well how can he keep pressure on the candidates. Okay, so you will find one difficult question. Okay, I will bypass it. The second one is difficult. The third one is difficult. Oh my God, the whole exam is difficult. I am lost. This is exactly the feeling they are trying to send it for all of you. The personal psychological capacity of everyone is very important. You have to know that what is difficult for you, most probably difficult for 80% of others. So it's difficult for almost all of candidates. So don't be afraid. Don't lose your concentration. Now, these points I'm talking about, they are not related to from where you will study, because all of us knows that GTGs, some selected topics in NICE, strategy tutorials, TOG articles in the last 3 years, sometimes maybe more, but all of us knows that. Okay, all of us know that we need at least 4 to 6 months for well preparing time. It depends on how much you are busy, how many hours you can save every day to do some practice. So these questions are well known, but the unknown part of the story is related to how can you understand the questions and manage the questions. So that's why I'm planning, me and Dr. Zaib, to do some new innovations in the field of teaching, in the field of courses, which will be extremely helpful to all candidates. We will do together live sessions about how to answer the questions with examples.
Exactly.
And one of the new techniques we will do is, I will give you, for example, I know that I'm telling them some secrets, Dr. Zaid, but it's a part of reassuring, you know, it's a part of reassuring of the candidates. For example, I will give you a question. You will answer the question. I will not move to another question. I will extract 3, 4, 5 questions from the same question by changing minor things. The age of the patient, 30. Now it's 40. How can you manage? The PMI is 20. Now it's 30. How can you manage? And by this way, we will be able to cover more than 1,000 questions by different ideas and different resources and different ways of thinking. I think this will be very important step in the teaching field, as well as it will help most of you to apply the knowledge in a correct way, rather than just keep talking about the curriculum, the topics, and trying to explain rubbish, which is already available to all of you. This is my point of view, and I will be very happy if Dr. Zaib is sharing the same ideas with me. Am I right, Zaib?
Yes, yes, exactly. And in fact, me and Dr. Hassan, we both have been so upset yesterday. So we spoke and we literally discussed that, what exactly or what more can be done. Okay. So together we have concluded that, okay, we will solve questions with you. Okay. And we will try to give you some sessions that how to solve questions, how to pick, the buzzwords. We always talk about buzzwords. Okay. So you have to pick. And always remember that, the no management is going to be complete if age is not given in gynecology cases. No management is going to be complete if parity or, the gravidity is not given in OBS cases. So, I mean, what I have felt myself is that candidates, they don't start reading question properly. They directly jump to the answer. I know this answer. I know this answer. No. Okay. Things will change. Like Dr. Hassan just said that, okay, what if they will change BMI in exam, what if they will change age in exam, maybe you know the answer, but maybe you have missed any point in exam as well. Okay, so all you need to do is that when you are going to read your question, just try to highlight, okay, the age is this, okay, the parity is this, gravidity is this, her actual sign and symptoms were or complaints are this. Okay, and now my question is that what is going to be most appropriate investigation, or the least appropriate, the symptom, okay, whatever. So we have to focus on all these important points. Some of the questions were incomplete, so sweetheart, I would suggest that do write it to RCOG. Okay, do give your feedback as well if anybody has any. Okay, RCOG is so open, so they can take your the all these complaints, or if they think that really these questions were incomplete, so maybe they can look into this. Okay, but moreover, I must say that usually the exams are set by all examiners. And what do you think, Dr. Hassan? Because me personally think that exam questions are set by examiners, okay, and RCOG examiners, all are RCOG examiners.
Yes. Exam questions for part 2 are set already 6 months before the day of the exam already. And they are reviewed by multiple examiners many times. Actually, one examiner is responsible for maybe 2 or 3 questions, and then the council will revise the questions again, okay, after that. So a committee of multiple examiners all over the UK are sharing the questions, and then the questions and the exam is already finished 6 months before the day of the exam. Okay, now the most important thing is for people who appeared in July, can we go for January, or we can postpone the exam for next July? Now this is a very critical question, and the only one can answer this question is the candidate, him or herself. Is his capacity is able to keep moving for the Jan exam, or the candidate needs some rest? I did it. I did some rest before between 2 trials in part 3 because I felt so disappointed. So I bypassed one exam and then get the other one, and I passed. So it's a personal decision, but my advice is don't let too much gaps between the exams. The guidelines will be changed, more TOG articles will be in the bank, and you will lose a lot of momentum, okay? Because before the exam, you are in the top performance. After the exam, your performance definitely will be decreased or declined. So to restore your performance again, it takes time, it takes effort. So if this gap is prolonged more and more, it will be very difficult to restart again. It's like you are starting from 0 point again. So my advice is don't take long breaks. Go directly for the exam. And the most important thing is you have to ask yourself why I didn't gain pass. Why? Everyone, believe me, my friends, everyone deeply in his mind, he knows very well or she knows very well why she didn't pass. But in most of cases, we are hiding these facts because we are not psychologically, we are not being happy if we are facing our problems. But you have to know, some candidates, they have so much, busy work, busy life, social problems, and many things that distracts the minds. And they know very well they were not ideally ready for the exam, and then they didn't gain success. So this fact should be corrected. Now, other people, everything was fine. The situation is suitable for the exam, but they didn't try to change the ideas, the mind, to follow the rules. Sometimes we are giving many rules to answer questions. But I felt, Zaib, in the previous patch, sometimes my name was mentioned in the group for some questions, and then they are asking same questions, answering by same mistakes, despite I explained the point in the live session. It means that you are not fully dedicated to the study, okay? And for this exam, you have been fully dedicated to the exam. These points are critical. So try to find why you didn't pass, rather than crying, rather than being depressed or disappointed, because depression, disappointment will never change the facts, okay? Try to be positive and try to find the weak point and try to correct it. Then you will easily pass, and we will celebrate all together very soon.
Inshallah. Exactly. So I am of the same opinion that anybody who has attended this July exam and flunked, I know, the most of you guys have flunked with, very close margins. So do attempt in the January. Okay. Don't wait for another 1 year. Again, I want to repeat the same. There are going to be more guidelines, and you won't believe that in June 27th, 2 guidelines have been updated. Recurrent miscarriages guideline from RCOG, and one more guideline, nice guideline on cesarean section. Okay. So they both have been updated, and recurrent miscarriages is almost, the change. It's on Willy's, the pattern again. Okay. So yes, more guidelines will change, more talk articles will come into, the place, so many things, so many new things. So again, if you will take a long break, so what will happen is that you will take a break of 6 months, and then you will start from zero again. And by the time you will go for your July exam, you will be in the same position that, okay, what seriously I have studied or no, or do I have to write this July exam or no? Or do I have to go for January exam? We do understand, the almost all type of difficulties, what everybody is facing as an overseas because of the rising inflation and everything. Okay, I would suggest that, if you really want to write this MRCOG, do try to be realistic, do try to cut down on your, the, if at all there are any expenses, here and there. So do try to save your, the each and single penny for this exam. Okay, if you really want to do this exam, again, sit with you, prioritize, what exactly are the priorities for yourself, your life, your career. Okay. And then of course, things can be easy. And not only this exam, almost all exams need, so many sacrifices, so many compromises as well. Okay. So yes, we have to sacrifice so many things. We have to compromise on so many things as well. And then only we can achieve something, isn't it? So of course, on the other hand, be prepared, be realistic. Okay. That every exam will have only 2 results, right? Either pass or fail. Okay. There is no in between or a middle kind of thing where you can fit in that, okay, this is borderline or something. Okay, so make sure that you are starting again. Don't take long break. Okay, again, take some time. Okay, take some time. Okay, 2 to 3 days. Sit with yourself. Okay, analyze again. Think about your time. Think about your the opportunities, or think about your circumstances again. Okay, because I don't know you personally. Dr. Hassan don't know you personally. We as a teacher can always give you the best choice. Okay, keeping in view that what we have been through and what we have been observing as a teacher and now as an examiner as well in RCOG. Okay, so again, keep your the morale and spirits high. Again, keep your concepts clear, not the keys clear. Work hard on the concepts. If your concepts are clear, trust me, you can do wonders. Okay, you can do wonders. Don't just look at the here and there. Okay, don't try to be part of so many groups again here and there. Okay, maybe it can be the fruitful, but at the end of the day it is going to stress. It is going to give you a lot of stress on your eyes, on you will be having headache, you will be tired. Okay, many of us we do get backache as well, isn't it, by sitting all the time, by I remember when in the last the few days we have been discussing together, Rabia, the Sara, Madiha, and so Sana. So no, we have been discussing that yes, we are having the pain, we are having the backache, we are having joint pain, we are having the of course the strain on our eyes as well. So please take good care of yourself as well. Your health is a prime importance. You yourself are important, okay, for you, your family, and your career too. Again, this is going to be just your in fact the choice that either you have to go for this January exam or July exam. But for me, if I'm a candidate at your place, I would not delay it for a year again. Okay, so this July and again next July, this is going to give me the 12 months again. So I'm not going to sit just for this exam. Rather, I will give my 100% again, by not leaving any loophole in my studies, in my the preparation. And yes, I will be writing in January again. Okay, but in the end, this is your life, this is your exam. Okay, only I mean, where you stand. Okay, but still, as a teacher, okay, we can always extend our help, our hands, our the guidance and anything. Okay, we are easily approachable. Okay, you guys can reach me personally, reach out to Dr. Hassan personally. Okay, and we do try to answer as well, because we both are working the practitioner too. So sometimes there can be the delay, but yes, but we do respond. Okay, so we are there, we are here with you. Okay, so and on the other hand, if you really feel that you want something extra from us as a teacher as well, you can always write to us as well. We will be taking all the kind of what you can say the suggestion positively. Okay, like today I took a suggestion that yes, I have to do some extra labor and delivery questions. So yes, I will be doing that. Okay, and like the Dr. Hassan just told you that yes, we are going to do the couple of question and Q&A session, you can say. Okay, in which we are just going to be doing questions and answers all the time. Okay, and inshallah we will be doing it together. Okay, so yes, I think this is too long, and by the end I would like again to say is that be positive. Okay, do try to think of what can be done more or extra to pass this exam. Okay, analyze and analyze, of course.
Always, I'm
And
saying, Dr. Zaib, I'm saying we are proud of all of people pass the exam,
exactly,
but we will be more and more
more
proud of people who didn't pass, and they will pass next time because they are real warriors. We are
exactly.
always saying that. and
Exactly.
and from my experience, my friends, you will never be so much mature and so much confident unless you experience failure once at least in your life, because failure is a very strong lesson. So you will be more confident and more mature when you gain success after failure rather than passing from the first time, believe me. So this experience is very important, despite it's very tough, but it's very important. Use it and never let it break you down.
Hmm.
Thank you, my friends. Thank you.
No. You don't have to lose, your confidence just based on one exam. Okay. So please don't think like this, Toshin. Okay. So I would suggest that please don't think like that. Like I said earlier, that, Dr. Hassan has just told you guys is that, he has failed as well. I have failed as well. So do you think that we are less capable or we are not capable at all of becoming MRCOG? So,
The
we have
problem,
become MRCOG eventually.
the problem, Zaid, we failed many times, not one time. I
Yeah,
know that.
exactly.
And the problem is you will fail more and more in your life, not in the exam. You will fail
Exactly.
to
This is
gain a
right.
job. You will fail to marry. You will fail to do many things in your life. So failure is not related to the exam only. It's related to the idea of life overall. So you have to accept it. You have to adapt with it. You have to be happy with it, because this is the life. You will fail once, you will success twice, and so on. So
Hmm.
I never being able to see or accept people who said, I lost my confidence, I lost my hope. Never to say that. It's a matter of time.
Exactly.
Maybe the God is preparing something better.
Exactly. And maybe, like I said yesterday, that, if it is meant to be, it will be for us. Okay. If we are destined to, do anything, so of course, we are going to be that. Okay. So yes, we have failed, but we have passed. Okay. So it doesn't mean, one examining, the failing one exam doesn't make you inferior at all. Okay. And passing one exam in one go doesn't make you superior as well. All right. All you need to do is you just need to the study. You just need to stay focused again. Just work little bit more extra, or maybe the little bit hard. Okay. So I mean, eventually, trust me, maybe I will meet you one day and you will be a MRCOG like me. Okay. So it's not like that, you are not going to be a MRCOG. Eventually everybody will be. Trust me, everybody will be. Mark my words. Okay. Today or tomorrow. Okay. Everybody will be. And inshallah, I will be, or you guys will be seeing us, me and Dr. Hassan as well, in your part 3 as well. So it's not like that we are going to leave you. Okay. You will see our faces in real exam too. So it's not like that, you are not going to, be MRCOG. You will be eventually. Okay. Today or tomorrow. Write it down somewhere. Okay. Write it down somewhere. So we are not going to leave you at all, sweetheart. So it's not like that. Trust me, course or no course, we are teacher. Okay. And teacher is a global teacher. Okay. And me and Dr. Hassan, I think we both have been adopted by so many candidates now that, we do try to listen to them all the time. We do try to talk to them as well, even on personal level too. We do try to, the kind of, I mean, whatever in our capacity, we can console, we can extend our help or anything. We do try to. Okay. So it's not like that, you are a bad candidate. Please write it down somewhere that Dr. Zaib has told us that I'm not a bad candidate. So I'm going to pass this exam. Okay. So today or tomorrow, trust me, we all will be in same row. Okay. Please, pardon me for saying something. एक ही सफ में खड़े हो गए महमूद अयाज, ना कोई बंदा रहा ना बंदा नवाज. So eventually we all will be MRCOG one day. Okay. So don't worry about that. Okay. We will all be, in the same row. All right. You got my point. So, maybe today or maybe tomorrow. All right. So inshallah, we will all be MRCOG. We will all be at same level. Trust me. Again, we are going to be, there for you. Okay. All right. So don't think that, we are leaving you or you guys are leaving us. So please don't feel that. Okay. And on the other hand, you don't need to be, the upset on this thing that you have, because you have failed this exam. So I think I'm a loser because I have failed this exam. So I think I can't do this thing. No, please no. Okay. It's not like that. Okay. So, it's not like that. All right. So please, nobody is loser. Nobody is like, kind of, what you can say, the useless as well. Okay. So please stop thinking like this. This is just an exam. This is just like another exam. We have been through our exam throughout our life. So it's not like that, this is very unfamiliar to us to go for another exam as well. Okay. The good part is that we have to be prepared. We have to find out what exactly was lagging in our preparation. I know you. I know you very well. So, nobody is loser. Trust me. If everybody is loser, I would have been the biggest loser because I have never failed an exam and I have failed my exam in this MRCOG. Can you just imagine? No, it's not like that. Oh, yeah, I have failed that exam. Trust me. And it was so miserable as well. And so what? So what? It didn't make me any bad candidate. It didn't make me any the bad teacher. Okay, so yes, failure or the passing an exam is part of our journey as well. We are doctors, trust me. And maybe don't you when we started our residency, don't you really think that you were very poor in your pervaginal findings or per abdominal findings, and today you are very good in that, isn't it? So yes, we learn day by day. We learn day by day. We improve on ourselves day by day, isn't it? So why just making one exam as your the kind of what you can say a landmark that okay, if you will pass this exam you will be a successful person, if you don't pass this exam you will be a loser. No, take it as another the exam. Okay, don't make it the part of, or you can say a matter of just life and death. Okay, so please take care of yourself as well, because you yourself are important for you, for your family. Okay, everything. And of course, as a teacher, as because we take courses too, so we are there to help you. And anybody who really want the any kind of help. And okay, I don't want to say it loudly, but yes, if you have any concern, anything, if you want to talk to me in person, you can tell me. Okay, I will try to help. I will try to sort it out. Okay, so don't think. And please, from tomorrow, okay, tomorrow will be third day of your result. So 3 days are allowed. After that, you have to get up, you have to gear up, and you just have to dust off everything. Okay, start your journey again. So it's over then. Otherwise, I will be like the bad teacher with gunda and with danda, the attitude, and that is going to be very bad then. All you need to do is get up, gear up, start up. Okay, start over again. Start from the scratch to just look at what exactly you have to do again. 3 days morning is enough. Okay, not more than that. That is even allowed in Islam. Okay, not more than that. And God forbid, mashallah, you are alive, you are breathing. Okay, you are doing everything. Okay, so please don't think so bad, and don't think and don't take yourself as a loser at all. Nobody is a loser, trust me. Eventually, mark my word, eventually everybody will be a MRCOG. Okay, eventually everybody will be a MRCOG. And maybe somewhere here and there you will be the remembering my words as well somewhere. Okay, that eventually everybody will be a MRCOG. So this is not a matter of life and death at all. Okay, yes, passing every exam is important for every candidate as well, but again, it's not like that somebody will die of not passing this exam. I know so many of you have already achieved a lot. So take it as an additional, the degree as well. Take it as an additional opportunity as well to learn and to improve on yourself. All right. So any other question, any query, anything? Exactly. I understand. It is very difficult, Rabia. I've been through that. Okay. And, I will talk to you personally as well. Okay. Don't worry. And, I was no different as a candidate as all of you. So it's not like, out of the world. Okay. Because we belong to a country, which have been suffering, a lot. Okay. Since ages. So, any exam, any international exam is not easy for any of us. All right. So, but this way or that way. Now, please don't say that, Baba. Don't say that. Don't say that. Okay. I really wish the happiness to all of you. I really wish all of you be smiling all the time. Okay. So don't say like that. Don't think like that. And nobody is loser. Trust me, nobody is loser. Okay. Please write down my words somewhere here and there, and do try to revise it, and do try to look at those words again and again. That nobody is loser, and eventually everybody will be the MRCOG. Every session with questions related to topic. All right. Me and Dr. Hassan, we will discuss, and we will come up with another plan, perhaps. Okay, and we will do something about that. So don't worry about it. Yes, Maria, I'm with you, sweetheart. Okay, I'm with you. Okay, so don't worry. Okay, don't worry. See, brainstorming, I'm always there. I do take session, and by the time 2 hours are done, everybody will write in the chat box, how much is left, ma'am? How much time is left? How much time I have to eat? I have to go. I have to pee. I have to do this. Okay. So, I mean, it doesn't work this way. This is not my exam, of course. Okay. Because I can talk nonstop. This is my job, isn't it? I'm already paid for it. This is my job because I have to speak, I have to talk, I have to deliver my lecture, isn't it? So all you have to do is, if you give your 100% to me as well, so I can sit with you, I can take, the hours and hours after having regular lecture, we can discuss questions as well. Okay. So, it's not like that, we cannot do it. Okay, so yes. So anybody who has any concern, let me repeat again, any concern in terms of anything, okay, regarding course or exam or anything, okay, so do talk to me in person as well. Okay, so I will try to, inshallah, sort things out for you. All right, so please, again, just let the conclude our session on positive note, that nobody is loser. Okay, and you don't have to stop anything whatsoever. Okay, and plus another important thing, because we are concluding our session, just let me tell you again, don't compare your journey to anyone's, because so and so has passed 2 years before me, so I have to pass this exam now as well. Okay, it's not a competition. Everybody is hailing their own life. Okay, so please be your own competitor, be your own best version every day. Okay, do try to improve on yourself. Got my point? Okay, any question, any query, anything? Yes, guys? No? Course will start. Sweetheart, it's already started. And so, okay, Nazia, do send me a message, or do send a message to the med exam team as well. They will help you. Habiba, I will kill you if you will lose your confidence. Okay? And I mean it. So all of you guys, please start over. Okay? And all you need to do is, there should be a separate, no, there shouldn't be. So there shouldn't be like this. You are not repeater. Okay? You are not repeater at all. Okay? You just need to improve on yourself. So it's not like that, you have to repeat and you have to think all the time that, okay, because I have failed, so this exam or this course has been designed for me. No, I mean, it's not like that. So yes, it will be same thing. It will be same thing. I will be with you. I will be with you. And like, in the last month, we have studied wholeheartedly together. So again, we will do the same. Okay. And inshallah, in this, we are going to bring a couple of more sessions as well, a couple of more Q&A sessions as well. Okay. So this is going to be good. So please stop calling yourself repeater all the time. Okay. You have just, they flunked, or maybe you have just, the could not score 2%. Like my father used to say that in next exam, you just have to study for 2% only. Okay. You don't have to study 63%. You have already scored 63%. Okay. You now need to work hard for 2%. All right. So stay positive, try to stay calm. I won't say stay calm, because of course it hurts, and it hurts so bad. Okay. So it's not like that, things are going to be easy, but yes, we have to look on, everything. Okay. We have to look at everything. We have to, look at our shortcomings as well. Because being a candidate, everybody has, like I said earlier, some strong points, some, the weak points as well. So we need to figure this thing out as well. Okay. Okay, Sabra, a team will, they help you. Aisha, if you are there, please help. Okay. All right. Okay. Okay. Fine, fine, fine. So inshallah, I will see you guys. I will catch you up again. And please don't forget to attend my session on 7th of this month. Okay. So I will be having discussion on new TOG articles from, the 2023. We will be discussing tuberculosis in pregnancy, management of tuberculosis in pregnancy, and we are going to discuss acute coronary syndrome management in pregnancy. Okay. So be there. We are going to discuss again. So I will be there, of course. So you guys can, ask me any question, anything, and hopefully, we will have good discussion. Okay. So see you guys, inshallah. I will catch you up on 7th. So don't forget that you are awesome, you are brilliant, and you are not a loser. Eventually, you will be a MRCOG. Okay. So that's it. This is what I have to say. Okay. Brilliant, brilliant, sweetheart. Okay. Najla, you can always talk to me. Okay. I know you are very upset. So my doors are always open and everybody knows that. Okay. So please do talk to me if anyone has any query in terms of, the exam or course or anything. Okay. Do talk to me. All right. Welcome. Welcome, sweetheart. Welcome. Madiha, I will send you a message in a while. Okay. Okay. Recording of course to revise. Yes, sweetheart. Yes, yes, yes. You can revise as many times as possible courses for you. Okay. And you will be having an access till your exam day. So don't worry about it. Even if you don't attend your live session, although it is very much recommended because in live session, we will be one-on-one and we can talk and we can, discuss and everything. But yes, recordings are going to be there. Don't worry about that. Inshallah. Okay. Inshallah. Catch me up on 7th. All right. Zahra, you will get, the link. Okay. And I think Aisha is going to assist you. Don't worry about that. Okay. Yes, yes, yes. Please do join because these two important topics are very much important. Okay. And tuberculosis in pregnancy and acute coronary syndrome in pregnancy. So, the candidates who know me, they know love of maternal medicine. So, I will do that. All right. I will write you. Don't worry. Okay, Najla, I will write you. Okay, Marwa, I will talk to Dr. Hassan. Okay. I will talk to Dr. Hassan and then, we will see what can be done. But of course, the separate courses are not going to be possible for us as well because, I'm working in hospital. Dr. Hassan is also urogynecologist. And, somehow, I think this is the possible and this is the, the time how we can, do that. Okay. But I will discuss with him. Don't worry. All right. Okay. Thank you so much, guys. Okay. Again. Let me repeat again. Let me repeat again. You are not loser. Nobody is loser. Okay. So with this positive note that you guys are going to start your studies, you are going to start with, the full zeal, full throttle. You are going to overcome your shortcomings. Inshallah, I will see you some other day. Okay. In the live session as well. And of course, in course as well. Okay. All the very best, guys. Don't lose hope and don't lose your spirits at all. See you on 7th, inshallah. Bye-bye. Good night. Take good care of yourself.